Well, good afternoon, everyone. It's noon, at least here on the East Coast. Welcome to our Friday webinar. If you know, it's the last Friday of the month, so we're with Dr. Laura Lee Hall, and she has Dr. Goode with us. And if it's Dr. Hall, you know we're talking vaccines in some form or fashion. Just want to go ahead, before I have them go ahead and give their presentation, just want to remind everyone that we will have our 19th annual summit, the second virtual, but 19th annual summit on health disparities at the last Monday, Tuesday, and Wednesday of April. So we'll be releasing that soon, the link to register for that soon. And just want to give you a reminder and hope to see you there. But without further ado, I'd like to pass it on to Dr. Hall.
Thank you so much, Brandon. And hello, everyone who's taking time to continue learning how to meet the challenges of this age in terms of vaccination and the COVID situation overall. It is my distinct honor and pleasure to introduce today's presenter, Dr. Kelly Goode. She is a committed innovator, leader, teacher, and provider. Dr. Goode is a professor at the School of Pharmacy at the Virginia Commonwealth University, VCU, and director of the VCU Community-Based Pharmacy Residency Program. She also serves as a community-based pharmacist practitioner at the Daily Planet Health Services, Inc., a federally qualified healthcare center for the homeless. Her resume is too long to recap for you. She's developed a number of innovative programs for pharmacists to provide care in the community. She has worked in many different settings: community, health system, long-term care, managed care, home care. She's board certified in actually several boards. She's authored numerous abstracts, publications, and articles. She's the immediate past president of the Virginia Pharmacy Association, a liaison member of the National Vaccine Advisory Work Group, and she's the former president of the American Pharmacists Association. Of course, you'd expect that she would have received numerous awards as well in her career. So I'm really excited to have her here today and really share her great service to people in the community. Put your questions in the Q&A box and we'll be sure to get to them throughout or at the end of the presentation. So I'm going to hand it over to you, Dr. Goode, and put myself on mute.
Great. Thanks so much, Laura Lee, and thanks for that great, kind introduction. I'm going to share my slides and get started. And I'm really, really excited to talk today about our vaccination program and how we're reaching individuals. And as we don't have all the answers,
Dr. Goode, you're a little bit muffled volume-wise. I don't know if you can.
All right, does that work better now?
Yeah, that's
is that better? Okay, good. All right, so to share some of our learnings, we're not, at home plate yet, but we can share some of the things that have worked for us and some of the things that have not worked for us. So I just wanted to make sure everybody knew where we were. So we're in Richmond, Virginia, which is the capital city of the Commonwealth. We have a little over 200,000 population within the city limits. We have a median income of about 26,000 in the city limits, which puts about almost 19% of the individuals who live within the city at the federal poverty level. And we're about, get that going. And then we're about half and half in ethnicity with African-American and Caucasian. We've had a little bit of an increase in homeless count, as you can expect with COVID, so about 10%. So when you look at the homeless of being those people who are actually on the street, about 500 individuals are on the street with multiple individuals in supportive housing that are at risk every day of losing their housing. The homeless crisis line last year had almost 5,000 people that they had outreach and helped, and most people were spending an average of 44 nights. And so there were 128,000 shelter beds that were provided in the city of Richmond last year. Our healthcare center is called Daily Planet Health Services, and we've been around for 50 years. And you might kind of wonder, why Daily Planet? So it was started early on for sort of a center for wayward youth back in the 60s. And these were sort of youth that had become disenfranchised with society. And so they offered shelter for the youth, they've offered meals, health clinics, and housing, health clinics, and then counseling for these young individuals to help sort of integrate them back into society. And so when it came time for a name of this entity that was helping these youth, they sort of felt like Clark Kent, who went into the phone booth and was transformed as Superman, that's what the Daily Planet had done for them. And so they named the entity the Daily Planet. And so that's how we got our name, and it stuck. We've transformed a little bit. In 2016, we became Daily Planet Health Services. And our mission is really to provide accessible, integrated quality healthcare to anyone, regardless of financial status. And so we have continued that. We are a federally qualified healthcare center for the homeless. We have several locations. We have 2 locations that serve as primary care clinics. The West Grace Health Center, and that's our sort of signature location. That's where we've started. That's where we serve primarily our homeless and public housing residents and people who are at risk for losing housing. We have in that location, we have behavioral health, medication-assisted treatment, we have medical care, we have dentistry, and in our Southside Community Health Center, we have similar services, and that center is across the river in Richmond. It's divided by a river. And that center serves largely a Latinx population, where 60% indicate that Spanish is the preferred language. We were fortunate last January that our a building next to us became available, and we purchased that. So we have now an alternate site right across the parking lot next to West Grace, which we named 511, probably better naming to come soon. We also have a medical respite facility that is above our Southside Community Health Center, which houses up to about 20 individuals for a 30-month stay that need to convalesce after a hospital stay or are too sick to be on the street. We have another facility called Safe Haven, where we have about 20 individuals that help them integrate with behavioral health problems back into society, and they can stay in that facility for up to a year. We provide primary care services to Henrico Mental Health. So we have a provider on site there. And then we also work with the Healing Place for men. And now we have a new facility there for women as well. And that's for individuals who are homeless, who have substance use disorders. And we provide primary care for those 2 locations. We offer integrated services. I mentioned that we have, the primary care. We have, obviously, with the population that we serve, a large case management and outreach worker population. We've talked about dental care, we have behavioral health, we have optometry services, health education. We also have pharmacist services. So I serve as the pharmacist on the primary care medical team. We're a patient-centered medical home. So we just received our NCQA accreditation again for being a primary, for a patient-centered medical home. So if you look at what are we doing in our visits, so in 2019, we had almost 42,000 total patient visits, and that was about almost 7,000 individuals that we cared for, about half and half women and men. When you look at the population, 52% are uninsured, and those that are insured, the majority of those have Virginia Medicaid. We were expansion state about 2 years ago. And so about 74% of our patients are at or below the poverty level. And then 71% of our patients are classified as homeless. So they're at really risk of losing their housing. Some of them may be sheltered, but they are in supportive housing and could lose that housing at any time. And we provided more than $2 million in uncompensated services in 2019. Our race and ethnicity, we have a large proportion of Black African Americans. Our white non-Hispanics, about 20%, our white Hispanic Latinos, about 16.5%. And then we did have a large percentage that have refused to report. So what has COVID-19 done at our center, and what are some of the things that we've done to prepare and take care of patients during this time? So we have a large COVID-19 pandemic planning team. We were fortunate when we purchased that alternate site at 511 that we hadn't really done anything with that site, and what are we going to do? And so we got that in January, and COVID hit in March. We made that our COVID testing center. So anybody who was sick would go there and not come into the 517 at West Grace or come into our Southside site. And so we've tested 9,000 people since March. And we also do a lot of testing offsite at shelter locations for people coming in. And we've recently just had a couple shelter outbreaks. We have our primary care clinic who's transitioned to televisit. So we've been able to do that even with our population. They're using their phones to do those televisits, or we're doing telephone calls. We canceled our group activities, unfortunately. We've had a lot of our medical visits be COVID related, and we've had a lot of our patients who've missed appointments and with chronic diseases and trouble with losing insurance and jobs. And so you can see that it's impacted our patients and our centers. Our vaccine program at Daily Planet, we have childhood vaccines and adult vaccines. So I didn't mention that our Southside Community Health location does serve pediatric patients. Our West Grace does not. And so we do have childhood vaccines at that site. And we primarily are just through the VFC program. So we don't have any vaccines there for insured patients. We haven't sort of moved to that because we don't have a very large insured population for our vaccines there. We also offer our adult vaccines there, and we also work with the Department of Health to provide vaccines for adults. So we get those vaccines free for people who are uninsured or underinsured. And then we have limited vaccines for insured patients. We typically have influenza, pneumococcal, and hepatitis B. Sometimes we have a Tdap for patients who are insured. And then we've just launched in December, we launched our COVID-19 vaccines, which I'll talk about. So influenza vaccines, I'm going to visit a little bit with that. We've had a great partnership with Dr. Hall and her team, and they've sort of helped us get around influenza and how can we do better in our influenza vaccine campaign. And so what we did this year was we identified influenza vaccine champions. We identified 8 of those. We had training through the National Minority Quality Forum about how to do strong recommendations, and we've seen our medical assistants be able to really employ that. We started a daily huddle as influenza vaccine season rolled around for discussion and education and questions. And then we reported our influenza vaccine numbers every week, and we're able to identify our influenza vaccine leaders who really got around, I'm number 1 this week, and and I'm beating you, and really getting around how many vaccines they were given. We were also able to incorporate into triage activities. So it was really great to be in the triage area and hear an MA bring a patient back and say, here's your paperwork for your influenza vaccine today. And they didn't really even ask, do you want your influenza vaccine? And so that's really was helpful for us moving our numbers this year. Those strong recommendations also occurred in not only the medical clinic, but the behavioral health clinic. We did a lot of messaging through our electronic health record. We were able to have that availability. So in the past, we didn't necessarily have flu vaccine available in behavioral health. They'd have to come upstairs to medical to get it. So we stocked it with a refrigerator to be able to store vaccine down there. So we were able to do that with our medication assisted treatment is down there as well. We had signs and recommendations out of our dental clinic. We have vaccines in our COVID testing location. We went to the healing place, which I'll talk a little bit about. And then we took vaccines to our Henrico mental health locations. Our CEO made influenza vaccine buttons for everyone. We did some social media, and then we increased our outreach this year that I'll talk about. So this is our outreach. In 2019, we went to 1 location for outreach, which was the Healing Place Substance Use Disorder Program for Men. And then this past year, we not only went there, but we also went to Caritas, which is our Commonwealth, our Catholic charities for people who are homeless. We went to we went to the men's emergency shelter, the women's shelter, and we went to several of the hotels to give vaccines as we tried to increase the number of vaccines for this year. Dr. Cook, our chief medical officer, really got around trying to improve vaccines. She wrote a letter to the editor this year talking about flu vaccines and how critical it was, and trying to make sure that we were promoting vaccines across the board. This is what we were able to do in moving our vaccine numbers from 2019 to 2020. We went from 895 to 1269, so we're pretty proud of that. I'll talk about some challenges, and I think we probably could have been a little bit higher if we had not received COVID vaccine, and sort of some of the things that we had to do around that. So what's our patient response been about influenza vaccine? So the positive is the flu button, the buttons, and that staff have received. So this year, about 85% of our staff got their influenza vaccine, which was higher than we'd seen in previous years. And many of our patients didn't want to get COVID and flu at the same time. And so we saw some people a little bit more interested in it because they didn't want to be doubly sick. Some of the negative messages that we continue to hear are some of that mistrust in the government, especially in some of our older African-American population. Some of our individuals were concerned about missing work if they've never gotten the vaccine before, that they might have some side effects. And then, a lot of our patients still continue to say, well, I've never gotten the flu, and so I'm never taking the flu shot, and so I don't need the flu shot this year. So some of our challenges were really around that increase in televisits, right? People weren't on site to continue to hear the message and have those multiple opportunities to get vaccinated. Our influenza vaccine season, we're typically still be giving influenza vaccines, and we're really not doing that very much because our COVID-19 vaccine arrived. And so now we have a 14-day window, and we're trying to really move those COVID-19 vaccines. So our season got cut a little bit short. I think we probably would have been much higher than 1269. We also saw this year incentives in our local community to get vaccine elsewhere. So Publix, which is a supermarket in our area, as well as Target, were offering coupons for people to come in and get vaccinated. And for some of our patients, that's an important, a $10 coupon can really help. And so we were also letting people know that they could go there to get that, especially if we thought that would be a benefit to them. And then some of our providers in our area, unfortunately, don't report to the Virginia Immunization Information System. So if we don't know they've gotten vaccine, it's hard for us to get that into our EHR and sort of see who's been vaccinated elsewhere besides us, because that's important just as well as who we're vaccinating. We want our population vaccinated. And so we may not have those vaccines charted in our electronic health record. So now I'm going to move on to COVID-19 vaccines and talk a little bit about what we've done in this area. So just to ground everybody, most people are probably aware of the phasing from the CDC, and Virginia has also done and followed pretty much the CDC phasing. However, they've rolled phase 1B out a little bit differently. They started with a checklist of frontline essential workers and moved it that way. And we've been working with, and I'll talk a little bit about our partnership with the Richmond City Health District. And they've also had a phased approach. They started with 1B, and then they have added into sort of their phase this people living in homeless shelters. And so that's really how we've gotten involved in moving out COVID vaccine. And I'm going to talk about that. So that partnership with the Richmond City Health Department has been really important for us because we got our first shipment of vaccine on December 23rd, and we started administering on December 24th. So we had to be prepared. We had to be educated about what we needed to do. We needed to make sure our equipment was right. We were already storing vaccines, but did we have enough room in our current vaccine refrigerators and freezers to store COVID vaccine? And what would that look like? What would we need for equipment when we went off site? So we had to purchase a portable refrigerator. Education and training of our staff. We began starting with education and training of staff. We started having conversations about COVID vaccine back in November, anticipating its arrival. And then staffing, what kind of staff are we going to need, and what might it look like? And I'm going to talk a little bit more about sort of how we've built our program. So those staff conversations have been really important. All of our staff met individually with either our chief medical officer, our chief executive officer, or our nurse manager to have conversations around COVID-19 vaccine, because we wanted to get our staff vaccinated. So they were, what questions do you have? What do we know about it? And we continue those conversations as we get updated news about COVID vaccine in our daily huddle. And so our daily huddle is a little bit different. I didn't really explain that in our influenza, is that we have the daily huddle for the people on site, but we use Teams, Microsoft Teams. So the whole enterprise for Daily Planet, which is a little over 100 employees, are on that daily huddle. So we're not just reaching the people who are in the primary care medical clinic at that time. We also launched a post survey once we knew we were going to have COVID-19 vaccines in our COVID-19 testing location. So once they've come in for a COVID-19 test, they get an electronic survey to see, would they be interested in the vaccine in the future. We started having patient conversations, but knowing we were still in 1A when we first started, and then we're moving to 1B, which is not everybody. But we wanted to see, what are your thoughts on the COVID-19 vaccine? What are you thinking? And starting those conversations early with our patients. And so what we're using, so we can identify patients so when they're eligible, we can reach back out to them. We're using the ICD-10 code and charts of Z28.83, which says COVID-19 vaccine not available. And so then we can pull a report out of our electronic health record to identify those patients that we had the conversation with and they want the vaccine, but at that day and time, they were either not eligible or maybe we just didn't have vaccine in stock, because in Virginia, we have had some shortage of vaccine. We've also started, we launched electronic health record text messaging. So our initial early was homeless. And so we began texting homeless on the morning and saying, we have vaccine for you today, and telling them to come in between certain hours to get their COVID vaccine. And then we've just launched that this week for 565 and over on Wednesday. So the delivery considerations are really, it's not like other vaccines. So those of you that might be already involved with COVID-19 vaccines recognize this. So you've got to know what number of vaccines you're getting. So you may not get the same vaccine shipment every week. You've got to know whether you've got first doses, second doses. You've got to be able to make sure you're handling and storing them correctly during transport. So when we do outreach clinics, we've got to make sure our portable refrigerator is ready. We've got to have social distancing for either coming into a line for a clinic or during post-vaccination wait time. And so that's been really our sort of the backup, is that post-vaccination wait time of having people socially distanced to be able to do that. The vaccination piece is not that hard. But it's really that post-vaccination wait time. And we've been able to use our alternate site 511 for closing that down for testing and using it for vaccine. So we have a vaccine clinic going on right now where we're doing second doses and then first doses for those 500 people who we text messages on Wednesday. They're 65 and over, and we're able to use that facility, which is very helpful. There were some questions about data entry and follow-up. So in Virginia, we are submitting to the Virginia Immunization Information System, and we do that through our electronic health record. Early on, and I'll talk about our 1A, what we didn't register those patients in our electronic health record, and we entered directly into the Virginia Immunization Information System. And so we're doing that, and then we're tracking vaccines through a document, COVAX, which Virginia is using, that takes our doses that we received versus our doses that we have administered. So we're doing that. And we're also using that data entry for follow-up and for some missed doses. We're into our second doses, and so I'll talk a little bit about how we're working on doing that. The other issue is that we're giving the Moderna vaccine in our clinic, and we are getting some extra doses. So we're using the dead volume syringes and able to get anywhere from 11 to 13 doses out. So we don't really know how many vaccines we're going to have it until we open that vial and draw those doses. So we do have a wait list of people who are appropriately in the phases that we can call on if we have extra doses. And we learned that pretty quickly at our first offsite. We were expecting more people and didn't have enough. And the chief medical officer and I were in 3 or 4 shelters that evening at 8 o'clock at night giving out vaccines. So it's trying to make sure that that they don't expire based on time. So scheduling of second doses. So we've adopted a sort of a way to get second doses and to work on our first doses. So we're giving all of our second doses on Friday. So even if you got a vaccine on Tuesday, you would come in 4 weeks on the Friday to sort of be able to consolidate the workflow, and it's acceptable based on guidelines to be able to do that. And so that's the way we've sort of been able to manage and work through the second dose scheduling. So how did we start? So we started with that phase 1 safety net providers. So the Richmond City Health Department worked with us to be the vaccinator for all the safety net clinics. So all the providers in the safety net came to us to get their vaccine. And so we opened up for our staff first on Christmas Eve and gave vaccines. And then we had several clinics the next week. And then New Year's Day, we vaccinated the rest of the safety net providers. And so we're now still doing some of those as people get more comfortable with the vaccine. They seem to, early on, some people were wanting to see how everybody else did. And so now we're picking up some of those few stragglers out of phase 1A. And then we've moved into phase 1B. I'm going to talk a little bit about how we've done our shelter workers, the homeless, and then now we're into 65 years and older, which we're really excited to be able to get those patients done. So phase 1A was the safety net workers, our staff. We had launched social media campaigns. So you can see this is the sign, the Instagram sign we had. We had vaccine, COVID-19 vaccine, big buttons, and we gave buttons to all the safety net workers so that they could have those when they start launching their vaccines, so that we could wear that we'd gotten our COVID vaccine. So we started with our phase 1A, and we had 400 doses initially to do for the safety net workers. We got some publicity. The Richmond Times-Dispatch came in and did a story on our vaccination program to fill the gaps of the people who are taking care of the most vulnerable and the underserved in our community. So then how are we really doing our vaccine delivery? So we're doing on-site vaccines, as well as having on-site clinics, as well as going to outreach. So I'm going to start first a little bit about our on-site or clinic. We have started we started when we went into the homeless of doing what we said about the text messaging to the homeless. We got vaccine for you this morning. We would open a vial and give the vaccine during that time. We've been able to also get some people in those routine appointments if we have the homeless coming in during that time. So we've started with the homeless and doing that. We're doing some daily vaccines in the clinic, and then we're also daily Monday through Thursday going and some on Friday going to outreach clinics, and I'll talk a little bit more about that. But we're using that notification of the patients, text messaging. We have the wait list for people if we have extra doses. And then, as I mentioned, we're running a clinic right now, and we're using our 511 or alternate site. So all we're doing in that facility today is COVID-19 vaccines. As we look at outreach, we were initially through the Richmond City Health Department given about 29 homeless shelters that we needed to go to do vaccines. And so what we tried to do is get, how many people do you anticipate are going to get vaccines? And then we used our outreach workers or case managers to help as we went into those facilities and the staff at those shelters and facilities. And we actually had a clinic day where we vaccinated the people who are working at those shelters as well before we went out and did our outreach. So this is just a chart of where we've been. So Caritas, as I talked a little bit about, is our church-based shelter program, which most of those are now in some hotels. We did a safety net shelter where there are 3 types of shelters there. There's the overflow or overnight shelter where they're housed at night. They come in at 4 o'clock at night and stay overnight and sleep in the ballroom. They also have some really high-risk individuals that if they get COVID could be really sick. And so they have their sharing rooms in the hotel. And then there's also at that safety net shelter, our COVID isolation rooms, which we didn't vaccinate. But we went there, we went to the YWCA, we went to the Days Inn, the Nights Inn, Salvation Army, we did their second shots this morning, the Candlewood Suites, the Virginia Supportive Housing, Home Again, Safe Haven, which is our facility. So really lots of outreach. So we have been going almost every day in the afternoons, evenings to these shelters to do the first round of vaccines, and now this week we started our second round of shots, and I'll talk a little bit about our experience with what we're finding there. So this is where we are. This is what our vaccine doses look like. So we've given, oops, sorry about that. Let's go back up. We've given a little over 2,000 doses. Most have been first doses. So you can see these, week 1 and week 2 were really our phase 1A. And even into week 3, week 4, we began to start our homeless piece. And then we were into dose 2. And then you can see now week 8 was last week, because we started week 1 would have been December 24th when we started our first vaccines. So you can see we're continuing to increase what we're averaging, which is what we think we can do right now. We originally had planned for 2 vaccine locations, our Southside and our West Grace, but we quickly began to see that was going to be overwhelming for us to start. So we're really running most of it out of our West Grace location, and we're averaging now about 200 first doses a week and 200 second doses a week. And we think that's a pretty good cadence for us right now, but we do need to begin to plan and implement and get our Southside location up more running. We'll be planning a on-site clinic there next week, because that's a Latinx population that is really underserved in our area and not getting the vaccine according to some of the data in the Commonwealth. And so we'll be having a mass clinic there next Saturday morning. So our race and ethnicity, as I mentioned, we haven't really gotten to our Hispanic population as much as we need to for where we are. So if you look at that Hispanic, it's only about 3% of our vaccines that we've given. This is our patients. We don't have ethnicity data on the shelter workers at this point, and the shelter workers and the healthcare workers, because safety net workers, because we didn't put them in our EHR. They would all be in our the Virginia Immunization Information System, because that was the other issue, is we have a pretty comprehensive, because we're a federally qualified healthcare center, pretty comprehensive registration process. And so we didn't want to have to put all of those sort of safety net healthcare workers who are not going to be our patients into our system. And so that's sort of why we chose not to put them in our electronic health record. But you can see the largest is mostly our white or Caucasian, but we've done a pretty large percentage of African Americans. We've had some good publicity from the Richmond Times-Dispatch again about vaccinating our homeless population. So a couple articles there. The on-site going to the different hotels. They came and did some interviews of patients and took some pictures of our vaccine clinic. And that was, fortunately, that was our first one. And so we did pretty well. And so we're glad to have sort of some of that publicity of where we're headed, and with our outreach of trying to reach the homeless. So what's been the patient response from COVID vaccine? So really, a lot of it's been, the staff has gotten it. So we're pretty proud. 75% of our staff have chosen to get their COVID-19 vaccine. We had a little bit, some hesitancy at the beginning, but after seeing that most of their coworkers were doing fine, we've gotten up to 75%. We'd certainly like to have that be 100%. We're seeing some of the same people who might not be getting the influenza vaccine a little bit nervous about the COVID-19 vaccine. Some people have some religious issues around the vaccines. So with 75%, we think that's a great start. The other piece is the patients, it's the trust factor. So, when we go to these homeless shelters, we have a lot of case and outreach workers who know these people, and a lot of them are our patients. So they trust the providers who are coming to the site to give them vaccines. So it's not like they just have seen this person the first time. And then the shelter workers have also been able to sort of help them. Some of the negative comments and some of the things around COVID-19 vaccine that's been an issue is patients are worried that it was made too fast. They've heard or seen people not okay after getting the shot. And then, this is a huge issue in this population, right? They don't have sick leave, that many of them have just gotten jobs and they're really concerned about missing work due to side effects from COVID-19 vaccine. And that could definitely be an issue around a second dose of COVID-19 vaccine. And then the other is just a general feeling that they're going to be okay and that they really don't need the shot. And so those are some of the things that we're hearing. And then some quotes from what we're seeing as our people have died after the vaccine. And so we're really working with our behavioral health people. This is coming out of that clinic and how they're having conversations around this and what we can do to help people understand this. The shot will kill, the shot will make me sick, want to think about it. So we are having a lot of people who are, when you have those initial conversations, want to think about it and having that, being able to have that conversation and continued conversation. And we do that with influenza vaccine as well. If we have a refusal, we always talk about with patients about, well, we're going to continue to ask because we believe it's really important and we can share things with you about why we think it's important. The other pieces I talked a little bit about this was it's made too fast. And one of the comments was, they made that really fast, but they don't have a cure for HIV. So you can see some of the perspectives of where patients are. And this is a little bit of a case from our clinic on Monday. And so it was our second dose clinic. And I want to sort of give you a little bit of scenario of what this is. So this is one of the hotels. And so when we initially were given this by the Richmond City Health Department, we always figure out how many people we thought were going to be there. And so we had we thought we were going to have 140 people to get the vaccine. So we go on site. So that's our estimated reach at that shelter. We went on site. We did 51 first doses. That's the one where the chief medical officer and I, we were told we definitely would have 80. And so we drew up all our doses and we were ready to go. And then we didn't have the 80. So we were really scrambling. We didn't draw up quite 80, thank goodness, but we drew up 50 or around there. And we were scrambling a little bit to find more people to get vaccinated because we had leftover doses. So we were headed out to the shelters that evening. So then when we went back, we only did 26 doses. And so one of the issues around the 26 doses, and now we've got a homeless population. So we're a month out for being in an overflow shelter, even in that transitional hotel room. And we only did 26 second doses. But we do know where a lot of them are because they were moved to a different hotel. And so we're going back to that next hotel next week. And then we also were able to bring some of the people in clinic. But when we were on site, we did 26 doses. So one of the questions that I received before today's webinar was, what are you thinking about vaccine for homeless patients? And based on, what we're beginning to see a little bit about trying to get these second doses and locating these people who may or may not have a phone, is maybe a 1-dose vaccine would be better than trying to rally them for a second dose. But I also think that what's interesting about this data that I want to share is that we did an additional 58 first doses. So that lets people now are seeing that the people are getting the vaccine and they're okay, right? They're doing fine. And so we had an increase in 58 doses that we did with the additional 26 second doses at that shelter on Monday night. So now I know we're getting down to time. I just want to show some pictures of our education campaign and where we're headed. These are sort of in draft form, but I thought I would share. So this is our CEO getting her shot and talking a little bit about the vaccine. So these are some things that we're going to be putting out in our clinics. We also have a Spanish, and this is Helen Tanner, who is our physician assistant at that clinic. She speaks fluent Spanish, and so they recognize and know her. We also have some different faces of our staff and talking a little bit about, some of the things that we're hearing about COVID vaccine. Can it give me COVID? Do I need the vaccine if I've had COVID? We also see as, can it track me? And don't trust the government. And again, this is our team. And then this is a putting you in the middle of the patient and a lot of our providers and healthcare workers and staff and team at Daily Planet. So just share quickly to wrap up some of the vaccine challenges that we've had. Vaccine supply is certainly a challenge. Incorporating that into the daily workflow is a challenge. Inventory management is a huge challenge. That's a daily management piece. And then that post-vaccination kind of waiting period. So I know we got some sharing and learning to do, but I'm just gonna share some of our learnings quickly as well. Staff buy-in's huge, that education, getting their vaccine is huge. Education and focus during that influenza season. Training, that strong recommendation training was excellent for our staff. Workflow changes of putting that in the triage has helped us a lot. And then with COVID vaccine, it's really been those conversations with staff prior to it coming. It's an all hands on deck. All of our providers are working. We have a brand new psychiatrist at the clinic, and he's been out giving COVID vaccines with me. And so it's been great to see everybody be part of this, that daily huddle, continued education, that strong recommendation, the trust factor for patients. And then we have a partnership. So we've had medical students, student pharmacists helping us at our clinics. That's been huge. The Virginia Commonwealth University, we've launched a vaccination corps of health professional students to help the community provide vaccines. And so that's been really helpful for us as we need to staff and man these clinics for all the outreach that we're doing. Our future plans are really that we continue that focus during influenza vaccine season. I really want to increase our outreach with all of these, new partners that we are doing COVID vaccines for. I anticipate that that's a great influenza vaccine campaign next year. So we'll be doing that, continuing our education. And then for COVID vaccines, continued staff education. We're going to expand our vaccinator pool and get our MAs up to speed. They've been granted to be able to give COVID vaccines by the governor through a new legislation, continue outreach. We're going to do targeted messaging based on phase. And then we're trying to get a self-scheduler up where patients can go in and schedule their COVID vaccine themselves. So we're working on that, and we're hoping that we'll be able to get that launched. So with that, just end with our motto is Daily Planet Health Services is connecting the dots for those in need. And we end our huddle with that every single morning. So thank you all for being with me today. And I've enjoyed sharing our experience with you.
Thank you so much, Dr. Goode. We have a number of questions, so I'm just going to dive right into them. The last question is, I'm going to go in order, but except for this one, will there be a sharing of slides? This webinar is being recorded and will be available. Kelly, I presume you're okay with us sharing your slides?
Yes, yep, most definitely.
Okay, so the first question came in. You mentioned that you offered flu vaccines in behavioral health, other less traditional locations. Who did the actual vaccinating in these locations? Which staff?
So either our providers could do them or our medical assistants give our vaccines too.
So in the behavioral health setting, that would be your psychiatrist,
well, he's brand new, so he wasn't here during influenza season, but I imagine he's ready to go. He can give influenza vaccines next year. But we have medical assistants in behavioral health, so all of our behavioral health patients get triaged just like they were coming into medicine.
All right, here we go. Please share how you get your staff to support COVID vaccination in staff and difficult populations.
So as I mentioned, they've had the strong recommendation, and then in those daily huddles, what we're doing is having those conversations. So what are you hearing? What have patients said? How to, for example, we were on daily huddle this week actually, and one of the behavioral health therapists put out there, my patient said that if they get the COVID vaccine, that people have died and they're worried about that. And so we had a conversation, and then the next huddle, we had more information and we're developing talking points for everyone around those messaging. So with everybody being at outreach and stuff, we're hearing these things and we're coming back and having conversations as a team about, how do we address those? And we do employ a lot of motivational interviewing right? So sometimes you just do have to roll with resistance, but it's, again, it's understanding what are the concerns and sharing and asking permission to share. You know, would it be okay with you if I share with you what concerns me about you not getting the COVID vaccine? And so you can do some of that. And so we're training our staff to be able to do that. And Dr. Hall's team has had some great webinars that our staff have attended that is really helping them with that.
That's great. There was a question about how you're able to text homeless people. Do they have cell phones in general? If they do not have a cell phone, how do you reach out to them?
So that's a good question. And so a lot of our patients do have cell phones and they're able to text. They may not have a smartphone, but they have a cell phone. But some of the most vulnerable homeless patients do not have cell phones. And so that's where our outreach workers really come into play. And so they're out in the streets. They know where the patients are, and they're able to go get them and be able to just get messages to them. And then, interestingly enough, we're we're in downtown Richmond, and so we're near the Virginia Commonwealth University campus. And so we do have a lot of homeless that just come in a lot. And I was working with one out before the webinar today, wanting to know about helping to find shelter, and we're able to connect them with their the outreach worker to get that. So we know where we can find them because we have a team that's out doing that.
That's great. So they know you.
Yes.
If someone ineligible shows up, are you still giving them the vaccine?
We are not. We're following our phases. We're reporting numbers every week of who we gave to and the type of individual that fits into that phase that we give to. Yeah, and we're not right now. So like our text messaging that we went out. So this is our first week. So it's our first experience with a big number of text messages on Wednesday, and we had no idea what was going to happen today. But we knew that it went to our patients, and we were only allowing them to get the vaccine if they were the 65 and over and they were registered with us as a patient. So if they shared that information with someone else, we're not giving the vaccine. We only have a limited, and we need to give them to our patients.
So we have a comment or question. Data in Maryland suggests that Blacks, Hispanics, and likely American Indians have similar COVID risk for various outcomes at ages 10 or even 20 years younger than whites and Asians. Has there been any move to have age by race specific criteria for who is in a category of 1B, 2, etc.?
I am not aware of that conversation yet in Virginia, but it makes sense. I know that we're not part of this, but our Richmond City Health District has just launched some mobile vaccine units to reach some of those populations. And then we're going to, now that we've sort of been able to open up, because many of those patients may or may not be homeless, for especially the Hispanic population. And so with the 65 and over, we're going to be able to try to get that. And so that's going to be our sort of next focus, is how do we move that at our Southside location. And our physician over there who's fluent in Spanish just did a radio program about COVID vaccine. So we're continuing to try to get that message out and using those providers who those individuals and patients know.
So there's a question, can you store the vaccine in the syringe after the vaccine's been prepared? And if so, for how long?
So we're using the Moderna vaccine, and so you can store it in the syringe but you can't be, once you have thawed it, so it's a 15-minute thaw, and then you can puncture the vial, and you have 6 hours from the thaw. So the syringes are only good for the 6 hours from the thaw of the vaccine.
If approved,
I'm sorry, Laura, they can be stored refrigerated or room temperature.
Oh, okay.
Yeah.
I'm just going to jump to this question, building on what you've just discussed. If approved, will your organization make a shift to the J&J vaccine so that only one shot is given? And you kind of alluded to that.
Yeah, I think we'll probably, I worry a little bit about complicating having more than one vaccine, but I think that we will probably do both. And probably try to give our patients a choice. But for some of the outreach, we may just use the J&J. we'll just have to sort of see what that looks like and how that's got to be handled, and whether we can get it through the health department, and what it looks like. So
what do you do if you have extra vaccine prepped because people did not show up? You've kind of answered that or addressed that. I don't know if you have any further comment on it.
yeah, each day we have a wait list of people who are on call who are in that phase. We've got a lot of patients. There's some housing units that are close to here that, you know, we have on our list. We've had those conversations with those patients and they fit the criteria for where we are, and we have a list and we call them and use that. We try very, very hard not to have extra doses, and we're getting pretty good at it. When we did our clinic on Monday, we had just enough. We didn't have any left over. We didn't have any left over at our outreach when we went to the healing place to do their vaccines for their second doses. So we're getting a lot better at it. You know, a few nights of going from shelter to shelter at 8 o'clock at night can cure you pretty quickly of being able to figure out how to do that.
I bet. Now, here's a question that says, are you aware of any state plans to prioritize vaccine delivery to unpaid family caregivers who do not have underlying conditions or are not considered essential workers?
I do not know. You know, the Commonwealth has laid out their piece. There was, and I'd have to go back and look, I think something about caregivers, but I can't remember what was written or said about it. So I would have to look that up and answer that question, but I think that's going to be state specific.
Yeah, that's my impression as well. I'm just scrolling through the questions. Are you, okay, so we just answered that question. Basically, we'll get back to you. There's a number of questions that are interested in the racial and ethnic and racialized groups and uptake among staff and among your patients. So, and even stratified by location. So I guess you are going to be tracking kind of the not just the number of African Americans, for example, who received the COVID vaccine, but also maybe the proportion who said yes versus no.
Yeah, I mean, we're really trying to look at that. I mean, I gave you the data that I had on our 881 patients that we've done so far. And as I mentioned before, we've not pushed very much in our Southside location, where the largest proportion of those people, Spanish is their first language. So we're going to start our campaign out there because we were really charged. I mean, as vaccine supply Virginia was really limited initially. So we were given every week and told we had to start with the homeless. And so those people that are at that clinic are not necessarily classified as homeless. A few of them are, but so we really focused more on the patients we were serving in our West Grace Health. But we will be tracking and looking at that and pulling that data to see. We will, as I mentioned, that Z20, that code, there's a code for COVID vaccine refused. And so we will be using that as well to track who has gotten it and who hadn't gotten it.
And this question as to, do you have vaccine uptake by racialized group? BIPOC, I'm sorry, I don't know what that stands for. White, Middle Eastern, North African, Hispanic, non-Hispanic, and by age and location. So kind of how deep are you going to get into that?
So we report through UDS, through the health, through our FQHC. And so we'll be using the classifications that they have for that. So they use race and ethnicity. So and I think that, let me see if I can go back. I used that race and ethnicity here. And so they use the race as white, and then they're using ethnicity as Hispanic or non-Hispanic. And so that's how they okay. Track the data. And so it'd be Pacific Islander. We don't have North Africa as a piece. So it's mostly So we have Native, Hawaiian, we have Asian, African American, white, Pacific Islander, Indian, and I can't remember, there might be one or more two there as the race, and then ethnicity would be Hispanic or non-Hispanic.
Thank you. And related to that question, or another question on racial ethnic makeup, one individual asked what the racial and ethnic makeup of your staff is.
So I don't have that off the top of my head, but we do have, we're pretty diverse. So we have, in our Southside location, everyone over there is fluent in Spanish. And so they would fit in within that ethnicity and race over there. And then the same for our West Grace, we have a lot of African-American staff as well. So I would have to get those numbers for you. I don't have those off the top of my head.
Well, thank you. I think that's really all the questions I'm seeing on the chat and the Q&A list. So, I mean, I guess I would just want to thank you so much, Dr. Goode, for a very interesting presentation, and more importantly, for the amazing work that you and your team are doing. They're lucky to have you in Richmond, and I think you'll be inspiring to the more than 60 people who've listened in today. So thank you.
I wish everyone good luck with your vaccines. It's a team effort. So having a great team always helps.
Okay, everyone, have a great rest of your Friday and a good weekend. Stay safe and healthy.
Thanks so much, Dr. Hall.
Bye-bye.